Hey guys, Dr. Matt here. So I wanted to touch base with you regarding the concept of revisional surgery. We've had many inquiries about revisional candidates, who deserves a revision, who warrants revision, and when is revision appropriate, okay? So here's what it comes to. There are two situations upon which a revision would be a worthwhile adventure, okay? Number one would be you've not lost as much weight as you expected in the first place. Number two would be you lost a tremendous amount of weight, and then through no fault of your own, you've put some weight back on. Okay? Under both of those circumstances, a second chance is warranted. Now, here's the key. It all kind of depends on what was your index operation. The bulk of surgery being performed today are gastric sleeves, which is beneficial for many reasons. Number one, you lose most of the weight, and the vast majority of patients lose the weight and keep it off with the sleeve alone. More importantly, in this particular regard, is if you happen to not respond to the sleeve like everyone else, or if you responded like you should have and then you put some weight back on, revisions after a sleeve are quite feasible and pretty safe compared to other options. You can go from a sleeve to a re-sleeve, you can go from a sleeve to a bypass, you can go from a sleeve to a loop to a duodenal switch, also known as a SIPS. Those are all meaningful operations in terms of risk profile as well as effectiveness. The sleeve is a restrictive procedure. Going from that to a malabsorptive procedure gives you that extra robust power that you need for further weight loss. However, here's the key. If you started off with a gastric bypass and you already have a restrictive and malabsorptive procedure, revisions from a gastric bypass to something else are controversial, both in terms of risk profile as well as effectiveness. There's been an abundance of research looking into patients who've had gastric bypass and what revision best serves them, and unfortunately, the jury is still out. So here's what it comes to. If you happen to have a massive gastric pouch, or the anastomosis has stretched and dilated too much, or if you are a very tall individual and they skipped a standard amount of intestines, a revision is a reasonable option, but it's something that we have to dig further into in clinic or via phone consult or something to make sure you're a reasonable candidate. What I would say in general, knowing that I've done hundreds upon hundreds of gastric bypass revisions in the past, is that the bulk of the patients come in and say to themselves, hey, I had a gastric bypass up front, I lost a tremendous amount of weight, I want a revision, and in their mind, they expect the revision to give them the same strength of the original surgery. That almost never happens. So oftentimes people have put on 100 pounds after a bypass, they want a revision, lo and behold, they get the revision and they lose 20, 30 pounds and they're quite disappointed, and the risk profile might not be in favor of a revision. One other consideration is some people will advocate going from a gastric bypass to a duodenal switch, which is a major operation. It's not to say that it's not something we consider. It is a major undertaking. It takes many hours in the operating room, and it's certainly not the kind of operation you would want done by anyone in an outpatient setting. It needs to be in the hospital because of the complexity and because of how long you will be under general anesthesia, okay? So, like I said, guys, the good news is if you have a gastric sleeve, a revision is both feasible, safe, and provides the weight loss you seek. If you don't have a gastric sleeve, it's something we can talk about, but you've got to keep in mind the surgeries from a gastric bypass revisional standpoint are trickier, more complex, riskier, and often met with sub-satisfactory results. So again, we have to evaluate you on a case-by-case basis, figure out what your medical problems are, what your initial weight was, what your current weight is, how much weight you've put on, what your original surgery was, what they exactly did during the original surgery, so we can best figure out whether the risk to benefit ratio is in your favor and what would be the recommendations based on your current situation. So the key here is give us a call, shoot us an email, get a hold of us. We'll review your case on a one-on-one basis, and we'll figure out what's appropriate for you, if anything, and make sure we're doing everything we can to make sure that the surgery that we're going to give to you is under the safest conditions possible. Go ahead and contact us at Bariatrics. We'll talk to you later.